Welcome to our Medicare training call every single Wednesday, 7 p.m. Central Standard Time. Thank you for plugging in today. We got a great call. We're going to go over some questions that agents have had while they were in the field, out there selling, questions that pop up on a daily basis. You'll see different things, commission statements coming out, stuff along those lines. You're getting your AP commissions, renewal commissions, those are hitting, and everything varies by company in terms of how they pay, how quickly they pay. Some pay fast, some pay slow, right? We already know in the beginning of the month, we got our United Healthcare. I saw the commission statement from, let me go to the carrier. Let me pull this on up. I saw the commission statement from Cigna that came in on the 17th, was it? Let me see here, actually, because I edited the file. It was generated on the 13th was the commission statement, the day that one was generated. So if you didn't get a deposit, I'm having some errors with for some reason, when Cigna had some contracts, they, for some reason, didn't put everyone on EFT. So if you would have just checked your mailbox, probably got to check if you didn't get a deposit from them since they generated the statement on the 13th. So you would have seen that come on out. They don't have a commissions department, so that ain't great. Humana, as we know, they generate every Thursday is when they populate. So the commission statement would be as of today, which would be the 18th, but it'll populate in the portal tomorrow. UHC is usually once to twice per week. They're going to pay you. And WellCare, you should have got paid that on the last cycle. Aetna is about once a week as well. So you'll be getting those commissions that should be flowing in. If you have any issues with commissions, make sure you reach out to the commissions department at each carrier themselves. With Humana, just let me know as well if you need help with that. I also send out emails with all the contact information for every carrier, so that way you have it. You can go directly on my website and where to view Humana's commissions, how to download your statements. So just keep track of all that stuff. It's great for you as an agent. I know what we reviewed last week, which was going in there and looking at your book of business, maintaining your book of business, and continuously marketing to your clients. So let's go into some different things. So now we're finally here, right? We're in 2023. We have all the plan changes that have hit. Everything's, going the way that we want it to, but you're starting to get some phone calls from clients that aren't happy for whatever reason, right? I want to go back, and that's okay, right? So just always, whenever you're leaving a client, it's always important just to let them know. If, let's say, for example, they were in a Humana plan and you change them to a Cigna plan, or Humana plan and Humana to Cigna, that's fine, right? So they like the plan, but then you change them to Cigna because that's, after going over everything with them, that was the option that they chose. Doctors are covered, drugs were covered, and everything like that. But for whatever reason, they just saw something on TV, or their, friend who's a mechanic at a garage told them Cigna's not a good company, right? Whatever reason clients can think of, there's like, I want to go back, right? Now with final expense, that's a different story. And it's a different story because when you change life insurance, right, you may not, as a life insurance agent, may not work with both or all the different companies, right? But when we look at the Medicare side, okay, you're looking at it, you're saying, yeah, I work with Humana, and that's exactly what OEP is for. Open enrollment is for if you want to make a change. You made a change and you made one or you didn't make one. It doesn't matter as long as you have a Medicare Advantage plan. But for people that made a change, that's why they brought it back during AEP, and they, didn't like it. They used to have to stay with the plan the whole year, right? If they didn't have a special election period or another reason to change. Now we got open enrollment period. So it doesn't matter if you made a change during AEP or not, that was in your best interest or not in your best interest, or if you missed the AEP window, as long as you have a Medicare Advantage plan, a Medicare Advantage prescription drug plan, or a special needs plan, one of those three, you can make a change using OEP, using the open enrollment period. So now's a great opportunity for you to go back or change to that other company, right? Like I tell the client when I leave, hey, listen, if you don't like it for whatever reason, let's just say, for example, you get it and you have your card and you just decide you don't like it, whether it's in January, February, or March, you call me and I can come back out and I can assist you with going back to that other plan, going back to Humana from Cigna, or vice versa, or whatever. It doesn't matter, right? So that's an important thing to note whenever you might have a client that calls you. So we know that open enrollment period, OEP, that lasts from January 1st through March 31st. Now, if someone is in original Medicare, right, they don't have a Medicare Advantage plan, or they are in a Medicare supplement, which would be original Medicare and a Medicare supplement, or just a original Medicare with the prescription drug plan, they cannot use OEP as the election period, right? They have to have an MAPD, an MA, or a special needs plan. So that's important for you all to know. Another thing that is really important as well as I go through this is understanding the changes that occurred. So, hey, in 2023, the Part B premium has decreased from what it was last year. So always having like an understanding and I'm going to get you all the exact numbers, always having an understanding of how the changes over the years have occurred. And why is that an important thing? Well, I think it's an important thing from an agent perspective, because you, as the agent, are more established, more as an expert when you have more knowledge of the past and how much money was taken out of their check, right? So if we look at it, let me click the button. I'm going to give you the dollar amounts. Let me see here. So show my premium details. All right. So in December of 2021, so 2021 in general, right? 2021, the Part B premium, which is the dollar amount that clients pay for the two different parts of Medicare, right? We have two different parts of Medicare. Part A is going to cover what we call your inpatient hospitalization. So it's anything inside the hospital. They call Part A hospital, right? Part B is what I call outpatient, anything that is outpatient. So if you have outpatient surgery, if you go to your doctor, your specialist, or they also call it durable medical equipment, which is DME, and that durable medical equipment, okay, is going to be such as like an oxygen tank or a wheelchair, right? Some durable medical equipment. That's anything that you get outside of the hospital, okay? So now with that said, what we do and what we look at is we, as agents, we should have an understanding of the history in the past and how much people were paying. And sometimes clients, they just honestly just don't know because of how they pay. So let's go over it. The Part A for clients is generally provided at zero cost. That's $0. Not that it's free, right? But it's $0. So what does that mean for me and for you? Let me show you. So, yeah, that's fine. Here we go. I'm going to give an example of someone that, oh, oops, hold on 1 second here. Let's go to the right screen here. Monitor 2. Okay, cool. All right, so let's go to, all right, so y'all should be able to see this over here. All right, so right here, we have the Part B premium, okay? And over here, it says premium for the month of January 2023. So the Part B premium in January 2023, how much they have to pay to have that Part B insurance. This is a payment to the federal government, okay? It's got nothing to do with an insurance company, nothing to do with it. You pay $164.90 with or without XYZ insurance company, it doesn't matter, okay? So with that said, right, for the clients, that's how much they pay. In the past, if we look down over here, I'm going to show you guys at the bottom. In 2021, the Part B premium was $148.50. And then in 2022, right here, the Part B premium went up to $170.10. Okay. So when I look at it over here, all right, what I see is that this is $164.90 minus, check this out, MA plan Part B premium. $125 Part B premium is being paid by the MA plan. Some Medicare Advantage plans pay all or part of your Part B premium. So that means the total amount of money that's coming out of this person's Social Security check is $39.90. Okay, so why is that so important? So now you can view their prior clients. So most clients, they're going to have a Medicare.gov account. So you can look on the government website and you can pull it up. It's under My Premiums. So you click that, you click their name, you go to My Premiums, and you can view this stuff. So you can look at it and see, hey, and this is just an example, but you could see what the client is paying, if anything, for their Part B premium, and if there's any subsidization coming in from an insurance company, like in this example, how there's a subsidization coming in from an insurance company that client, not exactly sure, but they have a MA Part B give back plan, right? So with that said, why is that so important for us as agents? So I want to look at the past and kind of see, all right, you're paying $148.50 in 2021. Then, whoa, the government jumped it up to $170.10 in 2022. Okay, thankfully, the government brought it back down in 2023 to $164.90. And I look at that and I can tell kind of the history and the trend of where they were at on a monthly basis of money taken out of their check. And when you can tell them that, yeah, I remember back in 2021, it was only $148.50. And then it went to $170. And then finally, the government took it down this year in 2023 to $164.90. So I always like talking about that in the past of Medicare and kind of how it operates. And I think that's a great thing for you to do as an agent, to have a little understanding of the past and the cost that's associated with it, as well as looking at things like the deductible, which isn't applicable to Medicare Advantage plans. The deductible doesn't mean anything. The Medicare Part B deductible, to be clear, does not mean anything for a client that has a Medicare Advantage plan. That deductible is encompassed in it, and that deductible last year was $233. And this year's $226. So that also went down. And the clients got their 8.7% increase in their Social Security check. So you better be talking to them about that. Or you're sitting down with a client who last year didn't have any money, right? And this year they got an 8.7% increase in their Social Security check. So Miss Mary, congratulations. Congratulations on what? You got an 8.7% increase in your Social Security check from last year. That's amazing. That's the largest and I know the dollar doesn't go as far as it did before, so maybe that 8.7% is enough, right? But you just want to congratulate them and let them know. I mean, that's phenomenal. That's great. So they're probably thrilled about that. So just keeping in tune with what's going on, which is, exactly why I always think it's important for agents to just stay plugged in and read the emails that I send on out, because they got some good info inside of them. All right, so now, last call, I talked about making sure that you continue to build your CRM. So that way for next year, next AEP, you got at least 40, 50 people to write. In the example I just showed you guys over here, you could have a whole database of 50 people that are in a Part B give back plan that insurance company decides to pull off the market. I mean, they're just completely done with it next year. They're like, yeah, we're done with that Part B give back plan, or they reduce it really heavily. So why is that so important? You build up that database, those people are going to need change and need help, and they don't know where to go. And Medicare, you think Medicare is confusing for you as an agent. Think about how confusing it is for a senior that knows nothing about insurance at all. Another thing that is really important is understanding the difference between an HMO and a PPO with our clients. Okay, so what I want to do is I want to bring up a little, let me see over here. I'm going to go to Sunfire and I'm just going to pull up a contact and show you guys. So who was I working with earlier today? Let me see if I have one already built here. So if y'all already know, make sure you're doing your health assessments. Health assessments will be paid in next month. Health assessments pay. Remember, you don't get paid a health assessment until the plan's been enforced for 30 days. And just going to give you money for fun. Okay, so now we are going to share this monitor here. So, okay, cool. So y'all can see it. All right, so that's horrible. 2.5 stars. Golly. Okay. So let's see. Why is that under recommended plans? Don't always pay attention to recommended here. Clearly, that's a 2.5 star rated plan. All right. So let's look at the United Healthcare PPO. We're going to do PPO and HMO. So they have both. Okay. So what's the major difference between a PPO and an HMO? So let's first talk about what an HMO is, and then we'll go into what a PPO is, right? The more knowledge you have, knowledge is power, right? To an extent, knowledge to generate revenue for your business is power, right? That's where the power comes in, right? Just having useless knowledge from TikTok or Instagram, that doesn't really do much for you, but knowledge on how to generate revenue does. So HMO, what does HMO stand for? HMO stands for Health Maintenance Organization. That is a network-based plan. It means you got to go within the network. You can't go outside of the network. You go outside the network, you're paying, right? That's it, unless it's an emergency. If it's an emergency, you can go out of the network. That's okay, right? So that doesn't matter, okay? So for you, if you're traveling right on the road and you as an individual, you have an HMO, just for your local area, you have an emergency or something, you go to an ER, it's treated as if it's in network. So emergencies are always treated as if they're in network, even if you're going to an out of network provider. Other than that, good luck. Now, you're going to have to incur the full cost of all the bills. What is a PPO? A PPO stands for Preferred Provider Organization. A little bit of a tongue twister there, right? Sally sells, what does she sell? Seashells by the seashore. So PPO, Preferred Provider Organization. So with that said, it's kind of in the name, right? They have certain providers that they prefer, okay? That means that if you go within their network of doctors, you're going to pay less money. But you can also go out of the network, right? So that's a pretty cool thing. And the way that I explain that to clients is really simple. I just draw a circle, and the circle is inside of it, I write HMO, okay? So if you have an HMO, and I don't really want to get too technical on the names, because what happens with confused people don't buy. So we need to keep it simple. Keep it simple, stupid. We want to make sure it's really simple for everyone to understand. So with that said, draw that circle, HMO. So with an HMO, Miss Mary, you can't go outside of it unless it's an emergency. Okay. If you go outside of the network and go see the doctor that you love, whatever that doctor charges you, that's what you pay. The insurance company is not going to get billed. Okay. But with a PPO, you can go in and out of the network. If you go inside the network, right, inside that HMO's network, you're not going to pay more money. But if you go out of the network, you're going to pay a little bit more money. But instead of, for example, instead of a specialist cost, let's go to details here and I'm going to look at it and we'll just scroll down. Instead of a specialist cost of being $35, Miss Mary, a specialist out of network is $65. But if the referral to the #1 heart doctor in the country happens to be out of network that you're going to go see, are you going to pay $30 more? Yes. Kind of a no-brainer. It's like, I don't care. I care about my health. $30? Yeah, like I get it. Hey, Miss Mary, you got an 8.7% increase. So when I look at it and talk to clients about it, what's better, an HMO or a PPO? A PPO is way more flexibility, right? Way more flexibility. And then when you put that in combination with a hospital indemnity plan, kind of have a little mini med sup light, where you got flexibility with doctors. You can go really see whatever doctors you'd like. You're going to have to pay more money. And if you go in the hospital, your maximum out of pocket is going to be covered. We'll go into that in a second. Okay. So what about this though? This POS here, right? HMO POS. And what does that mean? Sorry, let me just admit this person. Okay. So an HMO POS. So we have the HMO, Health Maintenance Organization, but then we also have the POS. That stands for Point of Service. Okay. So with a PPO, this is some more notes on PPO. With a PPO, you do not need, but you always should, with all of your clients, make this a habit. You do not need to assign a primary care provider with a PPO, right? Always do it. I mean, just make it a habit. It's a good thing to do. So the clients have it. It's on their card. They feel comfortable. But not all PPO cards will have a PCP name on it, right? They don't have to list it. I mean, go to the doctor. And with a PPO, you do not need a referral to go see a specialist. That is a great thing, okay? So when you have a PPO, flexibility, go in and out of the network. But if your heart hurts or your knee hurts, right? Go to the heart doctor, go to a knee doctor. With an HMO, if your heart hurts, your knee hurts, you got to go to the doctor first, get a specialist. Then after you get that specialist, or after you get the referral to go see the specialist, then you can go see the specialist. PPO, you go direct, right? Heart hurts. Okay, going right to the heart doctor. HMO, heart hurts. Go to primary care physician, get referral, go to specialist, right? One more step. Now, referrals nowadays are pretty easy. It's not like it's something that's complex. It's not like overwhelming. You used to have to go into the office all the time to get it done. Nowadays, you can call your doctor's office. Hey, can you give me a referral to go see, a doctor, tell them what's going on. They may want you to come in the office, may not. Okay. You go ahead and you can do it. And a lot of times, which is really cool today, is you can do the telemedicine, which I think is really awesome. I don't know if any of y'all have ever done telemedicine yourself and done it. I know, we're dealing with clientele that's not too tech savvy, but if you got a phone and you could download an app or something like that, that's pretty cool. That's pretty awesome. So with that said, it's important for you, especially as an agent, to understand how that basis works. Okay, so to go back to an HMO real quick. With an HMO though, and if we're looking at it, most clients are probably going to have HMOs just because of how important it is for them to have lower costs with going to doctors on a normal basis, right? And the reason why an HMO is generally going to have lower costs for going to see a specialist, right? Or have higher dental. It's like, so HMO is on the left, and I'll finish the POS part in a second. But why does it have more dental, right? Right? Why does the HMO have more dental, which is on the left-hand side? Why is the HMO specialist cost less than the PPO, right? Why is the cost more, right? For PPOs? Why is the maximum out of pocket? Why does that cost more money? Okay, those are great questions. The reason why is because of the control over the doctors and the networks and the negotiated cost. So when they have control over that, they can lower the cost of the bills that they are paying, therefore increase the benefits. So that's the bonus. That's the plus. That's the important thing for us as agents to understand. Now, what's the next thing on there is the POS, which stands for point of service. So point of service, it's like an extra benefit for flexibility, meaning that sometimes you can go out of the network with an HMO, right? So that is pretty cool. So it's kind of like a quasi PPO, right? That's pretty dang awesome. So let's see. So you can Google it and read a little bit more about it. Just type in what is an HMO POS, or since you know what POS stands for, which is a point of service. And let's see. So pros of an HMO, or that, let me see. I'm just trying to Google something and see if there's a good article to see it, but you guys can Google it and kind of see. The difference is it's like a mini PPO. So there's more flexibility, right? It's not as strict as a regular HMO is, where you can't go out of network. This, you can have exceptions to the rule, not just in an emergency. So that's pretty cool. As well as you can go to a specialist without always needing a referral, right? But you have to call and get it accepted. All right. So with that said, let's go to the next one, which is, and the reality is too, guys, like if a client's heart does hurt, okay, and they're having some type of issue, but it's not like a serious medical emergency at the point where they need to go to the hospital, right? they're going to call their primary care physician anyways. So if they're in an HMO or a PPO and they're having some type of issue, they're going to call their primary care physician to get a referral to a doctor. So don't let that be, the end all be all, like, oh, well, you have to get a referral with an HMO, but you don't with a PPO. They're still going to need guidance on where to go anyways. So just keep that in the back of your mind too, that's an important factor there. Okay, so let's scroll down here and let's go and, okay, so we have that comparison between the two. Let's go back to the maximum out of pocket. And let's explain what that is again. So maximum out of pocket, as you guys know, is going to be it's a combination of copays, co-insurance, and a medical deductible, not drug deductible. See how this has a drug deductible? Not that. Anything here, drug deductible, initial coverage limit, or catastrophic coverage limit. That's for another call. It's another day. This is for prescription drugs, what I have highlighted here. Okay. That is not for the medical portion of the health insurance plan. Okay. We're only looking here. So co-pays, co-insurance, and your deductible, not your premium and not what you pay for drugs. Got it. Okay. Now, with that said, that's what your maximum out of pocket is. Okay. So if you go into the hospital, let's just scroll all the way down to the bottom here. If you go in the hospital and it's $295 per day for 5 days, let's just call it 300, use a round number. That's $1,500. Okay. So that's one stint in the hospital. Okay. Now, if you go back up here and it's $3,900, you just spent $1,500 towards the max out of pocket for that year. That means you only have to pay $2,400 more dollars. And then after that $2,400, you do not pay a dime for any healthcare for the rest of the year. No copays, no co-insurance, no deductibles, nothing. You have now reached your maximum out of pocket. It's called a maximum out of pocket, not a minimum out of pocket, max. It's the maximum amount that you will pay in a single calendar year. That's your in-network maximum out of pocket. But what about the combined? Well, that's going to be in-network and out-of-network. Hence why an HMO POS or an HMO is not going to have it. That's not applicable, right? With this, it's going to have it for a PPO. That's the most amount of money you can spend in or out of network in a single calendar year. This is the most amount of money that you can spend in network in a single calendar year. Okay. Now, if I just go back to the bottom here and I look at the inpatient hospitalization for the PPO, that's more per day on that, and it's for 6 days. So either way, and then you can also look at the out of network hospitalization, unless there's an emergency occurring. Okay. Out of network hospitalization, $475 per day for 22 days. Make sure your ambulance is taking you to hospital and network. So with that said, $475 per day for 22 days would be really expensive. By that point, I'm pretty sure you even surpassed that max out of pocket, right? Nope, you just barely hit it. They do the math right. So that's 10,000 and change. So for 22 days in full, so 11,000 and change was the combined max out of pocket for in and out of network. So that's how it operates. And that's the difference between the two with an HMO and a PPO, and also throw in that little combo of an HMO POS. So that is indeed important for you guys to understand. And I just want to see if there was other notes that clients or that you guys had. Does anyone have any questions on that? HMO, PPO, HMO, POS, combined maximum out of pocket, why the benefits are going to be more rich with HMOs. So now that I have this, I'm going to go back over here. So with that said, okay, I don't want you to say to, every single client that, a PPO is hands down the best thing for you and that's it, right? A PPO is generally always going to be better in most situations for clients when it comes to flexibility of doctors, but not always with cost. That's why we have Sunfire and we do the comparison. So when I look at it, I mean, you look at the market and the client that you're dealing with. You're dealing with a final expense client. They get one check per month. More than likely, they're not going anywhere anyways, right? So if they're not going anywhere on a monthly basis and they're not traveling at all and they're within their network and all their doctors are in the network, I don't think that's going to hurt them at all, right? They don't really need much flexibility, do they? PPO, going to need more flexibility. So for more seniors that are a little bit more active moving around, and they don't mind a little bit higher cost when they go see their specialist. But for a lot of clients that are on a fixed income, as we saw with the specialist cost with the HMO was $20 and the specialist cost with PPO was $35, that can make a difference, right? Because that's a cost that they actually feel, that extra $15. Whereas the cost with the, or the, not the cost, but the allowance of dental of $2,000 and the allowance of dental with the HMO $2,000 and the allowance of dental with the PPO of $1,000, you know, that might not even be something that they even care about. They're like, I have dentures. I don't need dentures. Do you need a realignment? No, just got it done last year, right? So a realignment is when if your jaw changes or the dentures wear for whatever reason, you know, you can get it realigned so it's adjusted to fit your jaw again. So any errors, they can get a realignment. It's a cool little thing. So that's important, right? It's important to understand what things actually matter, right? Do you even need dental? Do you care about dental? I mean, how many of y'all on the call spend $1,000 in dental a year yourself? I don't know. Probably not many people, right? Is that an important factor? Like, do you mind paying more money for more flexibility? But also explaining to them what, if you don't, the next agent will, is that, hey, just so you know, the HMO always has lower cost. Majority of the time, right? High percentage of the time, the HMO is going to have lower cost. And here's why. Because within the network, the health insurance company can control the cost. They have negotiated rates. Okay. But when you go out of the network, they haven't negotiated rates with them because they're out of network. Right. So that's why. So that's the explanation of those. And let's see. All right. That's for another call. Cool. All right. So does anyone have any questions? As you can probably tell, I am a little sick. My son is now sick. Luckily for us, you know, he got sick, unfortunately. So this will be a nice night of sleep for everyone. And my wife is 7.5 months pregnant. So we're going to have a nice night. But as entrepreneurs, we don't get to not work. It's a blessing that we're as busy as we are. And it's just amazing that we're growing the way that we're growing and seeing how much production from every single agent is just putting up. It's just absolutely unbelievable. So thank you to everyone for just continuously crushing it. John, go ahead, buddy.
Hey, Holden, got a question about enrollment periods. And I believe if somebody's on original Medicare, the only time they can change to Medicare Advantage is during annual enrollment. Now, I wasn't sure if SEPs, if they could change during SEPs or not. I think it's only annual enrollment. Can you confirm that?
No, they can make changes throughout the year. They can definitely make changes throughout the year.
Yeah. If they want to make a change from a Med Sup with original Medicare, if they want to change over to Medicare Advantage, I think they can only do that during annual enrollment, correct?
If they're changing from a Med Sup and using trial period, like they want to go to a Medicare Advantage plan, yeah, they can make a change throughout the year with certain election periods for sure. So let me go to the election period cheat sheet.
I know they can't use open enrollment, that's for sure.
They cannot use open enrollment. No, they cannot. That's only if you're on an MA plan. So it has to be then. So if there is that, so if someone's on original Medicare and they now have applied for LIS, they get LIS, low income subsidy, federal program, they can now make a change. If they have LIS and they have a change in status, right? They're not maintaining it, right? They don't continuously have it. They have a change in status. They lost it or they gained it. Those three total so far, you can then do it. You are now eligible for full Medicaid. You can go ahead and do that. If you have original Medicare and you lost employer coverage, you can now go ahead and do that. If you have a 5-star plan in your area, you can always get into a 5-star plan. if you
Wow.
have a chronic condition. So if you have a chronic condition, now you're eligible for a special needs plan for a chronic condition that you did not have. Now you're eligible for that. Depending on if you had a plan before or if you were an employer coverage, you can absolutely use that as well. So if you had original Medicare and you were working on the job, now you're off the job. Oh, well, that's unfortunate. You lost that and now you don't have it. Well, that's loss of employer coverage, whether it's voluntary or involuntary. You have that option too. If you were just on original Medicare and you only had Part A or you only had Part B, and now you've added Part B, you've added Part A, now you're going to have a election period for that as well. So yeah, there's definitely a ton of reasons why they would be able to.
What about like natural disasters? Is that one of them as well?
Yeah, so a natural disaster, if a natural disaster occurred and it prevented them from using any of those other, large amounts, including AAP, right? Then the answer would be yes, absolutely. You could definitely use that election period for that. 110%. Absolutely.
Cool.
Or I don't know
Thank
if I
you.
had mine on screen share, by the way. Sorry, guys. Well, I just looked at it all. It's on my website, just so you guys know. So on my website under Medicare Parts and Programs, election period cheat sheet. Election period cheat sheet. You just pull that on up, and then you can read through that. So sorry about that, guys. I thought I was screen sharing with it. Or no, I definitely wasn't. But yeah, so there's definitely reasons as to why you will be able to do that all throughout the year for sure. So just being creative with clients. So that's a great thing and a great question, John. Thank you. Does anyone else have any other questions?
Yeah,
Mr. Dolbert, what's going on, my man? How you doing?
I'm doing fantastic, sir. Hey, I just wanted to verify that that over telesales, we don't have to do the recording. That was only during.
No, you have to do the recording is mandatory. You
all the
have,
time.
yeah,
Okay.
all the time. Yep. I mean, if a client's talking to you and it's just, hey, I heard your wife's pregnant, how's everything going? That's different, but it has to be in regards to Medicare Advantage, okay,
Right.
or prescription drug plans. If it's a Medicare supplement client, okay, that's different, right? So if they're talking about that product, then you have to record the call. And in Sunfire, let me see if I can find it while we're on here. I know I have a tutorial on it.
Yeah, I see it in Sunfire.
You've seen it in Sunfire? Okay, I had to set it up.
Start dialer phone.
Yeah.
At the top,
I was trying to see
top
if I
right.
can find it. Contact him. Oh yeah. So okay, let me see if I can do it. Let me see if I can find it. Under if you click your name, everyone, just so you know, you click your name and you go to your profile and you scroll down. It says add dialer phone for recording. Phone number costs $1 on a monthly basis. We pay for that, so don't worry about that cost. We pay for it. So add dialer phone for recording. You click that and set it up. Click that and set it up. So that's how you'll be able to do it. It's going to give you a toll-free number, and then you'll be able to take inbound or outbound calls. If you have a corporation and you have a separate one, like I do, I have a corporation, I have a separate account for mine, for my corp, and my personal with Sunfire. I can have two separate numbers, but I don't have a number on this account that I'm in right now. This is my personal one that I don't use. I use my other one. So with that said, y'all, let me know, does anyone else have any questions? The 1-800 number with Sunfire that you'll get, you can call that number and it automatically reads the disclosure, which is really cool. So it does that disclosure for you. You don't have to worry about it. It's all as soon as the call is on, as soon as the call is live, it's going to read that disclosure for you. I don't know, 10 seconds, or less probably. It reads the disclosure and you can carry on with your call. You can, if you're on your phone, you can go ahead and three-way phone call into that number. And when you three-way phone call, it'll add that one in and boom, recording's on. So let's say, for example, you're driving for whatever reason, and it's like, oh, boom, let me three-way in, starting to talk about Medicare, boom, put that in. And now it's the conversation's recorded and and you're compliant and it's stored in Sunfire. Another really cool feature. So, and remember, you don't pay for it, we pay for it. So You can pay for it if you want. Just send me some money. No, I'm just kidding. All right, y'all. Stephen, thank you. I appreciate you as always. And anyone else have any other questions? All right, y'all. Well, I appreciate everyone. Have a wonderful evening. Just give me a text, phone call, email. I got some videos that I'm uploading, and I will send this one on out as well.